Welcome to the September 19th Commissioner meeting. We'll start with the pledge of allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Welcome everybody for coming. So we've approved the minutes from the September 5th Commissioner meeting. I want to take a motion for that.
Motion to approve minutes is submitted from September the 5th. My second.
All those in favor signify by aye. We've approved the accounts payable vouchers. I can entertain a motion with that.
I'll make a motion to approve the accounts payable vouchers. And I'll second that motion.
All those in favor signify by aye. Aye. And we've also approved the payroll docket as presented. I want to take a motion on that.
I'll make a motion to approve the payroll docket. My second.
All those in favor signify by aye. Aye. So next on the agenda is moratorium on solar projects. So we have heard Planning Commission, we've heard others. We investigated what would be the scope. Our attorney informed us that we couldn't stop any that were already submitted, but we could put a moratorium on future projects. And so we've got a draft ordinance. We'll read that, and then we have some rules that we can suspend, I believe, to forego a second and third reading as long as we're all in agreement. And then we'll look at that. So ordinance number 2024. What the number will be? 2, 3? Okay. We'll find out. We'll have it on there. So, yes. Yeah. An ordinance establishing a temporary strategic moratorium on applications for commercial or primary solar energy systems in Jefferson County, Indiana. Whereas the Board of Commissioners of Jefferson County, Indiana, as the executive and legislative body of Indiana, has the authority to adopt ordinances related to administration of Jefferson County government. Whereas the Board of Commissioners seeks to foster desirable growth in an orderly and well-considered manner in Jefferson County. Whereas in 2023, Jefferson County adopted a unified development ordinance, which included Chapter 3, Section M, regulating the development of primary solar energy systems. Whereas the Jefferson County Office of Planning and Zoning has encountered significant confusion and difficulty in implementation of Jefferson County solar energy regulations. Whereas the Jefferson County Planning Commission has developed a technical review committee to review and consider recommendation of amendments to Jefferson County's current solar energy regulations. Whereas the Jefferson County Planning Commission Technical Review Committee had held public meetings, taking public comment, and employed the services of professional consultant in the consideration of necessary amendments to Jefferson County's current solar energy regulations. Whereas the Jefferson County Board of Commissioners has received numerous requests from the public and has held a public meeting to discuss the need of amendments to Jefferson County current solar energy regulations. Whereas the Jefferson County Board of Commissioners believe that a strategic moratorium on the processing of applications related to the development of primary solar energy systems is necessary to ensure that Jefferson County's regulations align with strategic development of unincorporated areas of Jefferson County and align with best practices for associated with primary energy solar energy systems installations, their construction, maintenance, and decommissioning. Whereas the Jefferson County Board of Commissioners believe that a strategic moratorium on processing of applications related to the development of primary solar energy systems is necessary for the best interest of the citizens of Jefferson County to ensure public health, safety, and general welfare. Now therefore be it ordained by the Board of Commissioners of Jefferson County, Indiana, that a moratorium shall be enacted within Jefferson County commencing on the date of this ordinance for the filing, processing, review, or acceptance of all applications related to commercial or large-scale solar energy systems in which electricity is generated for use or distribution off-site from the property wherein is generated, or storage systems or facilities not including residential or agricultural uses, and said strategic moratorium shall remain in place for until September 19th, 2025 at noon, or until the Jefferson County Unified Development Ordinance is amended and adopted to reflect the aforementioned consideration, whichever occurs first. and three, any prior ordinances that conflicted with this ordinance are hereby repealed and replaced. And if any portion of this ordinance is determined to be unconstitutional or in violation of state law by a court of competent jurisdiction, the remaining portions of the ordinance shall continue in full force and effect. This ordinance shall become effective upon adoption and publication as required by law. Passed and adopted by the Board of Commissioners of Jefferson County, Indiana, the whatever day of blank month 2024. So we've also had a request to, we've had our first reading. Normally to pass an ordinance, we have to have 3 readings. But if we, as the Board of Commissioners, are unanimous about it, we can pass it up. We can forego, we have to take a vote to forego the other 2 readings, and then we can take a vote to pass the ordinance. So that was our plan tonight. So I guess is there any public questions, comments on it? Sure.
I know you said when Orion's would not be included in here. Has that, no permit has been issued to Orion?
Correct.
So why can't it be included in here since it's adjusting all of that?
So Indiana Code 3674, 1109, it indicates that even after an application has been filed, once the application has been filed for a period of up to 3 years, any changes in the ordinances or statutes that would affect that regulation or that particular property or that particular application are not applicable to that application. So once the application is filed, that freezes sort of the law that applies to that application.
So filed and then accepted by the BZA or the Plan Commission. There are 2 different issues.
Accepted but not approved. Yeah, approved would be a different thing. Accepted means the application has been accepted by the BZA in the sense that it's been filed and has been accepted.
Do you know the date that was filed? Offhand?
I don't know the date that Orion's application is filed.
Okay.
Sometime in July.
Yeah.
But didn't it have to be accepted by the BZA?
Well, the BZA's agent, which is the surveyor, accepted it on that day. So as an agent for the BZA, that's what.
He had a sign that he had accepted that, and that was not in the application that was submitted to the public or made available to the public. So I just want to raise a question as to when it was actually accepted by the BCA.
So we can get that.
Okay, thank you.
Any other questions?
What was that code again, Pat?
Sure, it's 36, 7, 4, and then 1109, 1100. It applies to lots of different permits, but one of the permits that's specifically listed in subsection B6 are in fact special exceptions to special uses.
Any other comments?
Thank you.
Okay, thank you. It's good to see you smile. It makes me smile. Anyway, so other comments or questions? Okay, so I think we're in agreement. So I would entertain a motion if we are to forego the next 2 readings for this ordinance.
I make a motion to forego the reading.
The second and third reading.
Second, third reading.
Okay.
I will second that.
Any discussion? All those in favor signify by aye. Aye. Okay, so now we need a motion to approve the ordinance as submitted.
I'll make a motion to approve the ordinance for the moratorium on solar sites at this time. I second.
Any other discussion? All those in favor signify by aye.
Aye.
Okay. So. Next on the agenda is a residential treatment facility recommendation.
Hi, I'm Dora and I'm with Bethany Legacy Foundation. Thanks for having us today. I wanted to formally introduce Beth Keeney, who is here as the CEO of LifeSpring Health Systems. We are hoping today to have a discussion around selecting LifeSpring as the vendor that will help us build a mental health residential facility today. So Beth made a special trip here today to be with us, so thank you for being here.
Thank you, Dora.
And Emily.
Yes, Emily McDermott is our local manager here in Madison. And thank you so much for your time today and for letting us talk a little bit about our vision for Jefferson County. I want to thank Bethany Legacy Foundation for their leadership, and especially I want to thank Mr. Jim Porter, who has been working, I know he's in the other room, but he's been working on this for as long as I've been at LifeSpring, which is 16 years, and then I think another 10 years prior to me coming to LifeSpring. So I know I was here about 18 months ago and talked about the breadth of services that we have currently here in Jefferson County. And one of the things that we've been looking at is how can we continue to grow and meet the needs of folks in Jefferson County and in the area. And so what we're recommending is really a complete continuum of care, specifically for behavioral health and substance use disorder. And so what that would look like would be expanding our services to include not just the outpatient behavioral health and substance use disorder treatment that we do currently, but it would include primary care. We'll be making application in the next few weeks to the federal government to bring in community health services, which would provide comprehensive primary care without regard to ability to pay. We would also be able to grow that to include clinically managed high intensity residential services. And so what that looks like is folks who have a substance use disorder need to be stabilized. And so they would come and stay with us for up to 28 days and receive just comprehensive services that would include medically managed detox, stabilization, and then we would transition them to their next level of care, and also crisis receiving and stabilization. That's new for us. We've been doing crisis stabilization for about a year now. In Jeffersonville, and that's a service that allows somebody to come to you for up to 24 hours. I like to say it's putting pause in a crisis, and it gives you enough time to see what is it that the person needs. Do they need to go to the hospital and be inpatient? Are they going to do okay with outpatient care? Do they need to get out of the area and go to treatment somewhere else? So our model and our growing model is to have kind of these regional centers of a continuum of care that completely meet the needs of the patient populations that we serve. Again, our patient populations tend to be chronically mentally ill. They're medically underserved. We see a lot of substance use disorder, and we see a lot of folks who are low mod income. So the nature of our patients are pretty complicated. They've got a lot of issues with transportation, a lot of issues with inadequate access to food. We have a lot of unhealthy behaviors, including smoking, excessive alcohol use, and those sort of things, unhealthy eating, inadequate access to appropriate nutrition. And so by having these regional centers of excellence, these regional centers that really can meet the needs of the individual, we're able to provide really a whole spectrum of care. Over the past few years, I know a lot of folks in the community here in Jefferson County have been engaged in a discussion about what's the right type of care, what's the right type of facility. And so, you know, this is where we think that discussion is going, but we do see that this is an iterative process that we will continue to evaluate the needs of the community and make changes depending on what the needs of the community are. One of the things that we've learned over the past few years is that our facilities have to be flexible. So we don't want to scale up a very specific type of residential program without in knowing that, you know, where we may get 5 years down the road is we need more crisis stabilization. So we really are moving to sort of flexible facilities and flexible models of care. One of the things that I think is really unique about our continuum of care is we do have that crisis stabilization. we're not the right answer for everybody. Not everybody needs to come to LifeSpring. You know, sometimes they're better served at King's Daughter. Sometimes they're better served at Centerstone or even possibly across the river. But having an opportunity for somebody to come in, as an example, like let's say, and this just happened the other day, I got an email from a parent who said, my 20-year-old is out of control. He's intoxicated, don't know what to do with him, don't want to kick him out, don't want to call the police. We were able to bring this individual into crisis stabilization, let him dry out a little bit. He got to take a shower and he got a meal. And then we were able to figure out what's the next appropriate thing, which was not the hospital. And so we saved an unnecessary hospitalization. Law enforcement didn't have to be involved and the family got a break. And we could have held him for up to 24 hours, but our average stay is about 6, and he stayed about 5.5 hours, and we figured out what's the right place for him. What he ended up doing was moving into the residential program and getting involved in that medically managed detox. So he's able to take part in acute substance use disorder treatment. And so having that full continuum is really important. So it comes in through crisis stabilization, he goes to residential. When he finishes there, he'll have the ability to go into outpatient care. During his residential stay, we will check for infectious diseases such as hepatitis and HIV. We will have helped him stabilize any medical conditions. And so he's already on the right track to having much better, healthier clinical outcomes than he was 2 weeks ago. So that's kind of our model in a nutshell. We have one of these locations in Jeffersonville and we have one in Jasper. The Jasper facility just opened in February. It's going really well, and we are finding that that the community is really doing well with that model of care. Of course, Jeffersonville is different. It's much more population dense. That facility is completely full and has been for months at this point. Kind of ebbs and flows, but right now we have a very acute need, both in crisis stabilization and substance use detox. So I'm gonna pause here and just see if Emily has anything else that she'd like to add, because she's really our local community expert.
I don't have anything to add, but I'm here to answer questions.
Yeah.
If anybody has anything, but especially about our local office and population.
So happy to take any questions. Again, just appreciate the opportunity to talk to you about what our vision for Jefferson County is. Really appreciate Mr. Corder and Bethany Legacy Foundation for all of their work and leadership on this issue. You know, we are invested in Jefferson County. We've been here for a very long time. I think early 80s is when we moved into this community. We're not going anywhere, and our hope is to continue to grow and meet the needs of the community. So happy to answer any questions.
Beth, maybe I thought a few words about your process for community engagement before you kind of go too far into construction and the build, maybe a little bit about how you go about doing that.
Sure, that's a great question. Thank you. One of the things that we found when we built out Jasper is, you know, it's one thing for Beth Keeney to stand at a podium and say, this is what I think a community needs. Sometimes I'm right, sometimes I'm not. But we found that by having sort of these multidisciplinary advisory groups, that we really get a lot of good feedback. Things from, you know, just cultural things in a community that we don't know about, you know, like that's the color of this is a real conversation I've had. That's the opposing high school basketball color. And it's like, I get it. Okay. It's important. And that's not something, you know, I went to high school in Clark County. I don't know what Providence. Yeah.
I went to Clark's.
You're a general, I'm a pioneer, okay. So,
Oh,
yeah, so
problem, all right.
I could never have black and white in a building, right? Because Clarksville High School.
Oh, no, you could. You couldn't have blue.
But see, those things are really important. When we were building out in Salem, somebody who was involved in an advisory group with us said, where are our Amish patients going to hitch their horse? And it's like, I would have never known to think about that. And so part of our design became, how do we meet the needs of the patients we expect to serve? And it's totally different. One of the things that I have found true about community health and public health is that it does have to be community-based. What Madison needs and what Jefferson County needs is not what Jeffersonville needs. And in fact, many of our practices, like in our population dense areas, can be a block apart and very different practices because they serve different populations. So we found that by having an advisory group that provides the sort of feedback, you know, what if we did it this way? We really are getting to the best possible solution. We continue to engage the JRAC and the local justice groups, as well as healthcare providers in the community, to make sure that we are receiving feedback on, you know, just exactly what the community needs. We are the experts in treatment. That's what we do, but we're not the experts in every single person that lives here. And so we get that information back from the community by continuing these conversations and continuing to engage our community groups. We also have Jefferson County representation on our board of directors, Margot Olson from RVR, and she provides a lot of good, helpful feedback at the highest level of the agency. So does that answer your question?
I think so.
Did I miss anything else? You want to go?
This, I think we're good. Yeah.
Time, how long would it take?
Yeah,
Yeah,
Okay,
good question.
so it depends.
I know it does. I mean,
Yeah,
just,
yeah.
just,
So we
I'm
start,
not gonna come back a year later and like, well, you said it was, so, but to let people know about how long for this.
so, you know, it depends. It depends on, do you buy a facility that needs to be rehabbed, or are you building ground up?
So I guess, I mean, it sounds like there's a little bit of an evaluation
Yes.
to start with, timing wise there. Is that a year? Is that 6 months?
4 to 6 months.
4 to 6 months?
Yeah, so much of the work has been done in the
Sure, I
community,
understand.
again, through, Mr. Corder and the groups he's been involved in, and Legacy Foundation, Bethany Legacy Foundation. A lot of this work has been done. A lot of the analysis has been done. Some of the community need assessment has been done. We have the model. Essentially, we would be cherry picking what we already do and do well other places to fit what the community here needs. So I think you're looking at a 4 to 6 month visioning process. And then, you know, you're talking about design plans and
Sure.
bids and, you know, finding property. I think Emily and her team have completely maximized all of our space on Bear Street. So I don't think we can put a residential unit there. So we need to find a location and then either retrofit an existing structure or do a new build. If we do a new build with, you know, a land acquisition, we're probably
Sure.
looking at a year, 15 months.
It's quick.
Well,
Just got finished doing jail. That was, yeah. Anyway.
Again, the nice thing is we already have a lot of these design plans. We are, you know, when you start getting into the engineering of the property and that sort of thing, that's what takes time, but we know what our model is. We've got a lot of this design already done. We're just trying to figure out how to maximize the opportunity based on what the community needs.
And I think that adding that you already have your architectural firm and your construction group and partners that you've worked with on other projects,
Yes.
so you're bringing all that expertise. So
Yes.
you can sort of take care of all the management.
Absolutely.
Yeah.
We work with Laughlin Malay LMH, which is our primary architect or primary A&E firm. Construction wise, we try to work locally. You know, if there's a construction company, we always try to get somebody locally, not just because, again, you know, local is critical when you're talking about community health, but just
And
it's
for the
more
same
convenient.
Sure, well, yeah, and kind of what you said before, they know the resources that are in the community and they can help in that way, so.
Yeah, exactly. So we bought property out in Harrison County, near the hospital in Corridon. And one of the things that a construction company said locally is like, hey, you want to do some core sampling here and make sure you're not sitting on top of a cave. That's great advice. And so we were able to do that and verify that the property was solid and sound, and we hopefully, fingers crossed, won't have sinkholes opening up on it, but.
We have wetlands, that would be the water table and
Yes.
the level of the land
Yeah,
often are the
exactly.
same.
Exactly. We don't want water problems. Those are the problems that keep on giving. So, so I think that's it in a nutshell. We've got a great team. We're a really big agency. We have about 600 employees, about a $50 to $55 million budget, 30 facilities across southern Indiana. This is our easternmost area. We go all the way to Rockport and then all the way north to Austin. So we cover 11 counties. Just basic information about LifeSpring. We see about 20,000 patients a year in all levels of care. We see, folks in jail, we see folks immediately after jail. You know, babies just home from the hospital needing well baby checks and vaccinations all the way up to the geriatric population. So we just have a real comprehensive spectrum of care. Each of these facilities can see, typically we try to split male and female. And we would have anywhere from 10 to 12 beds, I would estimate, for each gender.
The Jim would be happy with that. 24.
Yeah, again, that's shaped by community need, right? It's really shaped by what the community needs.
And we are really far behind as a county. Since they closed the units down over here many years ago, and this population has had to just kind of.
They end up in the new facility that we built.
Right,
So they end up-
so, yeah, this is a big need in our county, our country.
So, do we need any formalized thing? Can we have a memorandum of understanding to kind of lay out what the plans are and?
Absolutely. I mean, I've been in contact with Live Springs CEO and legal. They've been very, very helpful.
Great.
And I mean, if Live Springs is able to develop it, then the county executive is able to authorize financial assistance for the purpose of developing the community mental health center here, and that includes residential treatment. So I mean, like, as far as funding goes, as it moves forward, I mean, obviously that would need additional votes as,
Sure,
those
Sure,
budget
this
numbers
is just
come in,
to
but-
kind of do this 4 to
Yeah,
6
that's
month
good. Yep.
evaluation and then. go from there, so.
I understand that you're proposing a residential facility, but I'm also familiar with the services that Live Springs offers to the other communities. You, will this be a federal qualified health clinic? Is that what you're proposing that encompasses all areas as well as dental health? I know some of your clinics do encompass the dental care, the primary care that serves the Medicaid population that's often underserved in our
Yes.
communities. So will this
so-
facility encompass all of that?
So yes, that's certainly the goal. So that's not really what I'm here talking about today, but our goal is to really have all of that in one location. We find that that works best.
Mhm.
That way people can transition seamlessly from one level of care to another. Our goal is certainly to have a federally qualified health center, and we will be making application to HHS, to the federal government, in I think the next 2 weeks. We've been working on it for a couple months now. And that application, I think, is pretty much wrapped up. We're hoping to be able to do that here. And again, you're right, it's dental, primary care, behavioral health, substance use disorder. We also do some obstetric care, not a lot, just because we're not the experts in that. We really try to rely on our community partners for that. But all under one roof.
Yes. Well, you served other communities very well, and I know from those communities experience that it wasn't competing with our existing healthcare. It was providing
Right.
services to those that typically do not receive the care or. the
Yes,
service.
I really appreciate you saying that. That's absolutely accurate. The population that we are really trying to get are uninsured, underinsured, and folks who are just kind of not making it to healthcare until they are really sick. So we really try to address inappropriate emergency department utilization, try to make sure that everybody has their vaccinations and that they're up to date on all of their just preventative health stuff. There are so many folks in our community that for whatever reason don't make it to healthcare. And so we really prioritize access, ease of access, as well as clinical quality and affordability. So in our outpatient, both in behavioral health and primary care, most of our patients pay $5 a visit, and that covers everything. So even if they have a really high deductible, they get assessed on the sliding fee scale. So if they have, like, let's say they have a $10,000 deductible, if their household income is $35,000, they may as well not have health insurance. They're never going to be able to afford that. But they can come to us and we can make sure that they get plugged into care and get the care that they need. We also work really hard to have referral arrangements for things like obstetrics, where it may not be something that we do, but we know people still need it. Cardiology, certain other types of specialty, orthopedics, endocrinology, that sort of thing. So we work with the hospital systems and community partners to make sure that our patients get all the services that they need. We all want the same thing. We want healthy people, healthy community. And we have found this to be an incredible model for getting that done. There's a really interesting report that just came out today from the Commonwealth Fund, which is a really well-respected think tank. And it talks about how bad the outcomes are in US healthcare based on the investment. And every single problem that they identify is exactly what our system is built around. Affordability, access, care coordination, just having the clinicians talk to each other. And I'm sure Emily can attest to that, just having the ability to call the doctor that maybe it's a primary care doctor and you're a therapist, but just to be able to call and say, you know, this patient's reporting this and how can we, you know, meet their needs. So I thought that was really validating, and it also really tells me we're on the right path, that we're doing some really good healthcare service delivery in our communities. And I will say, to your point, that the best healthcare service delivery we get are in these areas where we've got everything in one place. Happy to answer any other questions. Don't want to tie up your meeting.
I got one for the commissioners. Is the jail, the old jail, being considered as a location for that?
We've looked at it initially. We did get some pushback on that. Right now, we are in the process of figuring out what would need to be done to make it a juvenile facility. So that's kind of the direction we're going right now. That seems to have worked out the best. But we did initially, but I think there was some pushback on just it was a jail. So, I mean, I don't think it's off the table, but it's right now we've looked at, you know, because right now for any juvenile offenders, we got to send them 3 hours to Tell City or maybe it's Vigo County. So everybody in this area is kind of in that same boat. So,
Thank you.
okay. So I think sounds like the attorneys are discussing the memorandum of
We
understanding.
haven't discussed that specifically yet, but we certainly can.
Okay,
Yeah,
so if we go that route, and I think we can get that pushed forward and.
Great. Well, and I'll just finish with, you know, thanks again. And if anybody wants to write a letter of support for our application for the federally qualified health center, I'm happy to give you my card and coordinate that. But thank you all very much.
Thank you.
Thank you. Appreciate you.
So next on the agenda is awarding of the infrastructure master plan contract. So we have put out a request for proposal late August, yeah, sometime in August, for looking at some focus points within the county to see what kind of infrastructure might be needed if there's development that might happen. So I know you say, well, might. I mean, our thought is there's a lot going on in Clark County. Do we want to let it just kind of react to that here in Jefferson County, or do we want to have some planned places where we could do that kind of development? So that was our thought. We need to look at these things and see, you know, is that 10 years down the road? Is that 15 years down the road? When you look at what's going on in Charlestown, the housing is just exploding. And I don't know what New Washington's plans are or if they would do anything, but at least have some idea. All right, if we're gonna see that influx, where would we put that? What would be the best place? So that's one area, but we do have a couple other areas in the contract to look at. We really haven't identified them specifically. We're gonna do that through interaction with the consultant, but we figured it's better to be prepared than trying to react to a large number of people trying to move up 62 and, you know, have a spot here, a spot there. Try to be ready. So we awarded the contract to American Structure Point. The fee for the study, which will be completed in 8 months, is $55,035. So we'll have the plans ready. We're gonna look at not only just be looking at it, but having projects identified, funding sources identified, some of the specifics, of who you would be working with, should, once again, it is gonna be having it on the shelf and ready to go, but who would we be working with to put these projects or put these plans into motion? So. Any comments?
Well, we live in a buffer zone, the 2 mile buffer zone off of Deputy Pike. And we just got the solar out for now, but now they're talking about housing. So are we going to see if we can't get rid of that buffer zone so that we
We have
have
tried.
people that we vote for making the decisions, or are we, because the mayor has sort of, he's sort of threatened with annexation and different things like that. And we've had to spend this whole summer on solar, and now we've been threatened with housing and annexation, and it's not a comfortable feeling. What are the plans for our 2 mile buffer zone on Deputy Pike?
Well, we have tried in the past and we were threatened with lawsuits, so we can try to have those discussions. We do meet with them fairly regularly, not always talking about the buffer zone, but it is something that is not an infrequent topic.
Is the reason that the city wouldn't want to do that is because of the revenue that comes off of that buffer zone would feed the city?
Well, I think some of it is, they wanted, just like this study might do, they want to do some planned development. They know they need some housing. Where would be the best place for that? And if it's under the jurisdiction of the city zoning, which that's what the buffer zone is, they get to control some of that. So if they do annex it, the things that are there are already aligned with the city's zoning, not the county's, because there's some pretty big differences in the two.
And if it is annexed, is that going to make our property taxes go up so much that you couldn't afford to own 50 acres or?
I don't have an answer for that. I don't know. I could try to find out.
We live in fear of solar, fear.
I think annexation though is not just this, there has to be some approval on the people there that annexation occurs.
So then it takes over our lives and we have to sit
Well-
on every meeting and we had a pleasant, happy life.
I understand.
Jefferson County has been a beautiful place to live. And,
But you were successful in the first,
yes,
so,
but that's only for
I
a year,
know.
1 year.
but
So can your infrastructure consultant include interlocal agreements maybe for this, where we're going, if it's gonna be in housing, to include, is it only the southern corridor, or are you looking at
no,
all around the
it's
county?
all around.
So this could be maybe something that could be an interlocal between the city and the county to come up with this master plan that would address Ms. Weatherby's questions.
Sure.
I'm just asking.
Yeah, I think that's well within the scope of the project. So yes, if it's identified that those areas are areas that would be good in development, then you would have those discussions and we would work on those. I mean, in the end, it would still be, it would take that to have something like that happen.
Okay.
So, yeah. I mean, we had our attorney look at it. He had one little question. He just wanted to say that it wasn't an hourly thing. It was a lump sum based on each of those tasks.
Yeah.
So
That's it.
got that.
To be fair, it was a little unclear.
Sure, I understand. And he can entertain a motion to approve this contract.
I'll make a motion to accept the agreement for engineer and professional services.
1 second.
Any other discussion? All those in favor, signify by aye. Aye. Okay. Next, we have some department updates. Sarah. Fine, let's see who's around the door.
Like I said, I guess, focus spotlight on the burn ban that's in effect. We're seeing an increase in mutual aid requests, an increase in out of control fires. So, we ask that people adhere to this, burn ban, pretty closely. That way we save our resources for things that are dire needs. We're also seeing an increase in, motor vehicle accidents with pedestrians. Guessing it's the warm weather, increased
Really?
right? Warm weather, increased traffic, all the festivals downtown,
So is that where they're at, like, anything downtown?
downtown is where the main occurrence is. So dispatchers are staying pretty busy these days. Just ask for a little bit of patience. If you need us and it's not an emergency. So I'm closing. I'm pretty sure Smokey Bear would say only you can prevent brush fires. And
But a lot of people like, who's Smokey the Bear? His commercials have kind of gone away, but
they have, but we need them right now.
yeah.
Drive safely, especially in high pedestrian areas, please. Any questions, comments? Sorry.
Thanks.
All right, thank you guys.
Thank you, Brandon.
Something's going pretty good. I just wanted to really come and say that I'll be in the Dun Pink at the Pain and Fall Festival. I'm John the Animal Shelter. Half the proceeds will go to the shelter, so we're looking for the turnout and I'm hoping to stay wet.
So we did, send out a request for proposals on a design of a new shelter. We, 7 or 8 different, entities, won't get anything back until October, middle of October, so we'll see with that. And, at least start planning. Like I said, I don't know, we said just the design, we have funds to do that out of the, ARP funds. So we can get that ready, and I think that'll help give, not only, help people see what we want to do, but also it's just a little. Well, it'll show some, those ideas being put together, and it's not just, yeah, okay, so. All right, you too.
Thank you, Trish.
Yep.
Appreciate you.
Appreciate
Thanks.
y'all.
Gotta do this quickly. The logistics really be handled, started moving some stuff around, moving some things out, last week for the installation project. We'll have to talk about some things with the health department about some potential pod locations and how we're gonna change that. We're gonna change that policy. And I didn't know that they'd already started more installation in, so they haven't already started doing that today. So I know the county highway bureau has just got their stuff moving out of the way of that business, so I'm hoping that project, this spray stuff might be done, and then we might be, wrapping this thing up in the next, week and a half. So they made some huge progress. Been talking with the surveyor's office and just all of our local emergency management people, our emergency services people, the IXCR motocross race series that happened here for, it's been about a year and a half. I've had several incidents out that way, so we try to work a little closer with them about tightening up their safety policies and their safety program as a whole. We're gonna meet with them tomorrow at 2 o'clock in the afternoon to go over their event plan and their incident briefing tomorrow to discuss how we're gonna deal with emergencies and how it's gonna happen. They give us some paperwork to look over what their plan is. We've got some suggestions to add those things for them as well. And inform them about the burn ban on business, so they're aware of that. The contact person that I've been talking with, Daniel Hubbard is his name. He's a Brownsburg fireman, so he's and up in that Donut County of Indianapolis. So he's he seems like he's a pretty good guy to talk with. So we talked about before public safety vote. Just want to kind of update some information on that. The best I can tell and try to get some real numbers, this is really kind of the best guesstimate I think that we could offer early on. Especially if we go with the new purchase, then I'm talking with a lot of other departments and stuff. I would say about $3,000 would include the insurance, the maintenance, and the fuel guesstimates. And And again, you know, it's pretty hard to throw a dartboard when it moves that fast. So that increase may shrink a little bit, all that stuff. Our plan is to select, you know, up to 10 operators and make sure those are, you know, from all disciplines of emergency services, police, fire, EMS. And make those selections and just exactly what we're gonna put that in yet, we don't know. But if we do end up purchasing a new vessel, then it's a 12 to 15 month lead time. So we have plenty of time to decide some of the smaller details of the program. So that to kind of be a rush on that. I think the really important thing is to recognize do we really have to plan for these things and make some decisions about that before we put the storage location before the boat.
Sure.
So, had some trainings last couple of weeks, tabletop in Switzerland County, tabletop exercise activity this morning at the power plant IKE. There's one in Jennings County this next week. And IDH is coming here to put on a training session here about damage assessments for disasters. The weather, burn ban is probably been a hot topic, I know. According to Brandon, yeah. So whoever doesn't know who Smokey the Bear is has not lived a grand childhood, so I hate that. But so according to National Weather Service, the report that Jefferson County has had 0 measurable rainfall in the past 72 hours, and the outlook is not any better. And to Brandon's point, I'll say this: we've had a few mutual aid runs to go help other counties. I think the proactiveness on your part to take a look at the information and make a good decision that's proactive rather than wait till all these things start to happen. It seems like it's served us pretty well so far this season. And you know, I was talking with a couple of our chiefs, it would be nice for us to make some good decisions early, so you don't run the weekend out there, you know, putting out, you know, fires all weekend long, all of this. So I think that's a testament to our proactiveness. And how closely we work together as emergency services workers and with you guys as commissioners to make those things happen and really to the betterment of the county. So thank you for that. I really appreciate that for sure. A couple other things I just want to mention about the boat. I was pretty startled at some of the statistics that I asked the dispatch to look up to. I knew it was busy out there because I've got a boat and I like to spend some time out there all the same. Just some of the big numbers that jump off the page for the last 5 years. They went back and looked, and I don't have a total number of how many calls we got about incidents on the river. But some of the big ticket items, sadly, are there were 18 calls for possible jumpers off the bridge in the last 5 years. It's a pretty startling number to me. 19 calls for boats, some semblance of distress, whether that's out of gas, whether they're sinking, whether they're on fire. I need to dig into the call a little bit deeper to find out just exactly what that number really means. And then even more surprising than that to me is 23 calls for vehicles that were in the river, and one of those was confirmed entrapments. So I think sometimes we forget about how much goes on out there, and I think we've taken a little bit we've not taken enough responsibility for some of that stuff out there either. We've got 13 miles of coast. And we have a lot of people that are pleasure boaters and fishermen and all kinds of things out there. It's a huge commercial traffic zone for us, and we're just not equipped for any emergency that might happen out there. And even just the service. I mean, I think all of us are pretty happy if we have a flat tire and a sheriff's deputy or city police officer drives by and stops and helps us. That's pretty awesome for them to do, and I think we would all kind of expect that from them. But if you have a boat and you're running out of gas on the water, nobody's coming to help you. And I swam my boat to the shore to walk it down the bank before all that business and call for some help, and been lucky to get some people told me. And so I think, again, we've got an opportunity here to do better. And I think that the numbers, according to dispatch, and I'm not even called to Kentucky yet to see how many they have gotten called, but they even ship some things to us as well. So I was really surprised at how large the number was of our calls for service that we have out there on Hellwater. And we rely on Milton, Kentucky population 600 to be able to take care of business. So that's all I have. You got questions? All right, fantastic. Thank you.
Thanks.
Jason.
Oh,
You got a short straw.
Yeah, it's pretty short. Just give you guys an update here on county highway stuff. Bridge 6, beams have been set, looking really well. They're planning concrete next week, weather permitting, in case we do happen to get that little spit of rain. So hopefully that'll be going well. Want to thank Matt with the foam insulation in the building. That is absolutely awesome with very needed, so that is great. The total patcher tank was installed today, so we're pretty excited about that. That was a pretty good feat there to get done, so. Milling on 975 is completed. They replaced some culverts on 975, and then they started milling on Greenbrier. I'm not sure when they'll be completed with that. It'll be here in the next couple of days. And then we are still in talks on the GPS with the capability of diagnostics and everything with Samsara and Geotabs. Samsara is currently our front runner, and we're still gathering information still on final discounts with Geotab. So we're working with them, trying to improve our safety with the drivers and the equipment out there and hopefully maintenance, you know, so. But other than that, you got any questions?
Thanks.
Thank you.
Thanks, Dave. I'd just like to say thank you to the BZA for the Unified Development Ordinance we do have. Because at least we've got some guidelines where we would have had none. Because I know you guys labored probably over a year on it. with
Yes, the plan commission would have worked on the new
input,
ordinance.
meetings and.
But it was a combination effort. The commissioners took a lead on making the funds available to be able to have, someone available to assist with that. And, also, you know, Commissioner Bramer took across on the technical committee and the review and so forth. But, as I stated earlier, planning commission member, we were looking at all of our ordinances at that time. They did not have anything to rely on the solar. And we did not understand at that time the depth of what was involved for the solar. And since then, I became more aware and appreciate the action that the commissioners took this evening. I think it will be able to put most of our community in a better position going forward.
I mean, was it a perfect document? No, but your willingness to go back now and address and get, you know, redirection.
It was difficult because the existing, probably 99% of our ordinances, we had something to rely on as a starting point.
Right.
We knew what had worked well for our county and what had not worked well, but when it came to solar, we didn't have as much of that, had zero of that.
Really?
And then even reaching out to other counties at that time, there wasn't a lot of experience there as well.
Yeah, thank you for that.
No, we're still working on at a meeting coming up 1st of October with president of the juvenile facilities in Indiana to look at our new part of the old jail or the possible juvenile facility. So we're kind of excited about it as far as not putting people in it, right, but not having to go 3 hours away with our deputies, and they no more than get there. With one scenario we heard, and the judge wanted to see them back, and they turned around and went back 3 hours, and back 3 hours, and went to court for 15 minutes, back again. And 2 days later, back and back. We're spending lots of money in traveling that if we put that together and then put the comparison to maybe making our own juvenile facility, might be kind of impressive, really. I mean, then other counties close by can use ours too.
I think we're looking to have someone operate the juvenile facility rather than having additional, so there are people out there that do that now, and in talking to the state, they have people who do it well. And so we've been in discussion with them to make sure that they've got experience with it, and we're not gonna.
Is the state hospital an option? I worked on the adolescent unit for over 10 years at the state hospital, and we had 13 through 18-year-old males. And that changed when they redid it, and all the population was going to have to be housed together. and they couldn't do that, but it was a wonderful facility for the, juveniles there. And that,
The existing facility that's, I guess, to the, I hate to say it, to the left as you drive in, that one over there? Or is that, or is it another one?
well, it may be part of the jail part now, but
Okay,
all the buildings are pretty much the same.
yeah, we had looked at some when we started 5 years ago, looking at the jail, and once they had abandoned, well, they didn't abandon them, but they hadn't done anything in them for 10 years. It was, while they were built very soundly, there was
Oh, they
a
are.
lot of, most of them, at least the two that we looked at are down, and then they just recently took down Camp Hall went down too, so we can,
I don't
uh,
know. I
for
know
the-
that it worked well.
sure.
I think DOC is also looking to expand over there, which is frightening.
I think the rumor is they're supposed to get the rest of the
Mhm.
buildings. now.
Right, yeah.
So we talked to them, but the state would never really give us a, yeah, we'll let you know when. It was like, well, so anyway, but. We'll look.
That's all I got. Well, other than Dora getting the CEO of Life Springs here and keeping our ball rolling on getting us a mental health facility and keeping us, getting our county healthier and wealthier and wiser.
Thank you. Thank you.
On that, I have a process question, maybe for legal or the commissioners. Once we get the MOU, what is the next step? Does it come here for a vote or is it, what's the official process?
I mean, we'll probably sign it.
Yeah.
And if they sign it, I mean, it'll be something we both sign. But I mean, I think they've already kind of started evaluating anyway, so I think that's fine. And just
Okay.
give us something official to
Okay.
do that. Is
Thank
that
you.
okay?
Yep.
Can do
Thank you, Dora.
Thank you, Ron.
Do you know how soon the ordinance will be on the website so it can be shared with the public?
Yeah.
In the morning? Thank you.
it. Anybody else on the?
One quick comment I want to touch on, the buffer zone question that came up. And, you know, I want to give credit back at the time, especially Commissioner Little had looked at and responded to the concerns of the county citizens that lived in the buffer zone. There was a great deal of problems because it was somewhat of a no man's land. There were some that we controlled zoning ordinance there, but the county did not necessarily have ordinances for nuisance maintenance and so forth. When we looked at that in detail, the planning commission got involved after the county had taken the steps to withdraw from the buffer zone. And if I recall correctly, and it's been quite a few years ago now, but the county, it did not appear from the past court cases that had taken place over buffer zones that the county had any possibility of being successful if the city had filed a lawsuit. There were cases that had been decided as close as New Albany, Indiana to here. And because of the infrastructure that the city's extended in those ages, it was not going to be possible to take that. And I don't think, just wanted to not create false hopes going forward that the county would be able to change that on the buffer zone. It would have to take a mutual agreement with the city of Madison. And it did not sound like that was a possibility the last go around.
Thank you. Yeah, thank you. You're right. I mean, we did change, we pulled the nuisance part out of the zoning so we could address some of those nuisance
Yes, you took some
concerns.
very
and then-
good steps there, and that has helped a great deal.
One more. I thought of something else. One more. I'm getting older. Canaan Fall Festival is coming. We typically, the council comes before the commissioners to ask to close the roads for the Canaan Fall Festival. I think that kind of slipped up on us. So me and my son was talking about it last night, riding back and forth to work. So I'd like to kind of, I can't vote on it. Is it okay if we shut the streets down for the Canaan Fall Festival Saturday and Sunday?
I don't have a problem.
Yeah, I don't have a problem.
The last 60 years.
Yeah.
Oh, we kind of not been here.
I was like, wow, I don't remember.
Please,
So you want something,
you
you want something official?
Form of motion.
Sure.
I make a motion that we allow the Canaan Fall Festival Group to close the Canaan city streets for the festival.
I second that. All those in favor signify by aye. No.
Conflict of
It's not gonna change it, but anyway. Anybody else in the public? Yep.
Bobby's not here. I just want to thank him for at least getting rid of the potholes. We've got a gravel road, but that's better than what we had. Hopefully the grant comes through where we can get that blacktop. Because I'm not gonna give up on blacktop.
Chip seal?
No. It's been chip and seal for the last 50 years.
One thing that he taught me is you never say, you say resurface.
Yeah.
You never say that.
The other thing is, what got us in the mess anyway was the millage from the highway. And I think I had addressed this earlier, but just wanted to make you aware that those are being hauled out. They are going to a feedlot, but it's not there. So, just so you're aware. All right, thank you.
Thank you.
I have a question about conflict of interest. One of the members of the plan commission is also a landowner who has leased land for the solar project. And one of the people on the BZA is a brother to one of the landowners who has leased land to the solar project. Should they not excuse themselves from those positions in this context?
The plan commission is not considering the application. The Board of Zoning Appeals is the only body that actually considers the application. The plan commission is focused just on the evaluation of the actual ordinances and is not specifically with regard to any specific application that doesn't come before them. There's a potential that a development plan would go before the plan commission. It's not necessary that that happens, but it could. In that case, certainly if there's a landowner who's leasing as part of the project, they would have conflict and would have to step away. Having a sibling who is potentially associated with the project is not a direct conflict of interest. A direct conflict of interest is when you or your spouse have a direct financial interest in the transaction.
I would think
And
it
so-
would be anyone in your family.
I've done the research on the issue, and I mean, like the way the conflict of interest statute reads, is specific to you and your spouse. So immediate family, meaning, your small family. But yeah, as far as I can tell, a sibling does not qualify as a direct conflict of interest.
But wouldn't they excuse themselves from the appearance of it? I mean, wouldn't that be kosher? Wouldn't you think that? I mean, I don't know what their, how they feel about it or anything else, but I would think that would be,
That exceeds the legal question, so.
It is.
So I don't know that we couldn't, you could. Yeah, I don't think, we can't do anything. It's gonna be up to them if they decide or not.
sort of like the Supreme Court.
Not at all. Not even close.
I'm here with me laughing.
I don't have anything, so I'll entertain a motion.
I make a motion to adjourn.
Second, your motion.
I think very signal my mind. Thank you for coming.